what are 5 things that could be a sign that someone has been exposed to mold?
Fatigue, brain fog, cognitive dysfunction of all kinds, rapid weight gain or loss, and unusual neurological presentation. So numbness, tingling, weakness, burning, ice picks, crawling sensations, involuntary muscle movements, and often depression, sometimes suicidality. And in kids, it's often more neuropsychiatric symptoms than, tummy aches and headaches, but then they all of a sudden are anxious. They all of a sudden can't sleep. They're all of a sudden depressed and crying out of nowhere, and they might get OCD, they might get tics. A lot of the mycotoxins that are pathogenic or disease-causing are nerve toxins, so they attack the central nervous system and the peripheral nerves as well. I always like to say if you have more than one trash can diagnosis like IBS or fibromyalgia or chronic fatigue or mixed connective tissue disorders, then you've probably got biotoxin illness, mold or Lyme.
Welcome to the Your Lifestyle is Your Medicine podcast, where we do deep dives into topics of mind, body, and spirit. Through these conversations, you'll hear practical advice and effective strategies to improve your health and ultimately add health span to your lifespan. I'm Ed Paget. I'm an osteopath and exercise physiologist with a special interest in longevity. Now, did you know that mold in your home can cause serious health problems? Did you know how to test for mold? And do you know how to determine whether or not the mold you have is dangerous? Do you know how to treat mold exposure? Now, if you're like me, you probably said no to all those questions. Well, I've got good news for you, because today my guest is Dr. Terry Fox. She's a holistic integrative functional medicine doctor based in Colorado. And she's well known for her expertise in addressing fatigue, bioidentical hormones, sleep disorders, gastrointestinal dysfunction, chronic inflammatory response syndrome, and our chosen specialist subject for today, mold toxicity. She also likes to sprinkle on a little bit of Lyme disease and helps with that as well. So Dr. Fox is a family-trained physician who combines these natural healing modalities with her comprehensive training in Western medicine. In her practice, she blends herbal medicine, nutrition, exercise counseling, supplements, and stress reduction techniques. And like, in my opinion, doctors of the future will be, her practice begins with a thorough 2-hour intake to identify underlying triggers of imbalances, and she utilizes cutting-edge technology and lab testing to tailor individualized treatment plans aimed at restoring wellness and balance. Now, mold toxicity is such an important topic, and it's commonly overlooked. And this can, unfortunately, result in deaths, as we saw a couple of years ago with a young boy in the UK. So this is a super important topic and something that I really think we should be paying more attention to and getting as much education on as possible. Dr. Fox, welcome to the show.
Thank you for having me.
All right, I want to start this with knowing a little bit more about the symptoms of mold exposure. So what are 5 things that could be a sign that someone has been exposed to mold?
So symptomatically, fatigue, brain fog, cognitive dysfunction of all kinds, rapid weight gain or loss, and unusual neurological presentation. So numbness, tingling, weakness, burning, ice picks, crawling sensations, involuntary muscle movements, things like that.
Okay. Does a person have to have all of those to have a diagnosis, or just 1 or 2 of those?
Yeah, even just a couple. Fatigue, brain fog, headaches, and migraines are really common, and anxiety and insomnia.
Okay. So that covers a broad scope of symptoms. And we're going to tease out how to find out whether those symptoms are something else or whether they're mold later in the show. But I'm interested, how did you go from a standard medical doctor to a mold expert?
I always wanted to do more integrative, natural, holistic medicine. And so I trained in that after my medical degree. And then I did a lot of functional medicine training, and I was doing functional medicine for years and enjoying it and having great outcomes with my patients. And there was about 15% of my patients that wouldn't budge. They just wouldn't get better with the normal functional medicine matrix and interventions. And it turned out that most of these patients had biotoxin illness, which is Lyme co-infections, mold, toxicity. And so I ended up diving a little bit more into that. And then what happened was my son got really sick. So he was 8 years old. He was one of those really active thrill-seeking maniac little boys that was running around constantly and busy. And he started limping. And he started getting stiff and he started getting anxious and he started putting on weight. He was this underweight, scrappy little kid. And so I tested him for everything. And then he ended up having Lyme disease. And, this is quite some time ago. And so I brought him to this wonderful Lyme doc, Dr. Stephen Harris in California. And he gave us a urinary mycotoxin test for mold. And so we did the test on my son, and his results were through the roof. And from there, I began learning about mold and how you can't really clear Lyme or treat Lyme in the presence of mold. You always have to treat the mold first. And so that was my introduction. And then I just learned more and more about Lyme and about mold, and mold trumps a lot of other diagnoses. So yeah, I ended up, becoming a mold expert.
With that presentation of your son having a limp, being really active, and putting on some weight. So myself as a manual therapist, I might have been like, well, he's hurt his hip and he's put on weight because he's not exercising. So is Lyme and mold toxicity commonly misdiagnosed or not reported? Or
Yeah, it's often misdiagnosed. So the symptoms are they're pretty big. There's a large amount of different symptoms, and they're a little vaguish. They could, sound like a lot of different things. It often gets misdiagnosed, mold and Lyme. I always like to say if you have more than one trash can diagnosis, like IBS or fibromyalgia or chronic fatigue or mixed connective tissue disorders, then you've probably got biotoxin illness, mold or Lyme.
I'm thinking there's going to be people listening to this and they'll be like, that could be me. I've got X, Y, and Z, and no one's given me a diagnosis that makes any sense. My doctor's not interested. So what would be the next step in a patient's journey if they become aware that they're not right? Then what?
Yeah, so if they're if they feel mold is, suspicious for them and the picture matches their, clinical symptoms, there is a few little things you could do before paying for testing. So there's the visual contrast study you can do online. There's a couple different ones, and it's a visual where you look at a pattern and you write what you see. And when you have mold toxicity in your brain, you can't see the pattern inside the thing in the visual contrast study. So you fail.
That
Yeah,
really,
yeah.
it's really scary.
Yeah. And then when you get rid of the mold, you can see it. It's
Ah,
crazy.
because I see those
Um,
things and it says like, do you see the girl or the candle? I'm like, I
It's
don't.
it's kind of like that, but
Yeah,
it's for
yeah.
mold. Yeah, it's a fingerprint for mold. And so that's kind of an easy way just to see like, oh, okay, well, I'll do one of these. There's also some good. So SIRS is chronic inflammatory response syndrome. That's the disease you can get from mold toxicity. And there's a few really good SIRS questionnaires online that you can ask and see if it looks suspicious as well. And then if you want to know, you just do a urinary mycotoxin test on yourself. So mold releases mycotoxins that are toxic to humans or disease-causing pathogenic. And so you can find these toxins in the urine. And so there's a couple good companies that do really good urinary mycotoxin tests. And so, you give a urine sample and you either have mycotoxins or you don't.
So let's say it's wintertime, or autumn, I should say. There's more rainfall. It's getting a bit moldy. It's musty outside, and you do one of these tests. Does it show that you have like a chronic mold exposure or an acute mold exposure? Like how do you differentiate the difference? Or is there a false positive or something like that?
Yeah, so it can't really determine whether it was a previous exposure and you brought it with you, it's living in you, you've colonized, or whether or not you're being exposed right now in a house. But it does distinguish between like outdoor non-pathogenic molds and indoor toxic molds.
Okay, wait. It colonizes inside of you.
Yeah.
What? Tell me.
Yeah. So I was just, a good example is imagine you're living in a moldy house and eventually, it's humid out. And so the mold is sporulating, which means there's spores up in the breathing air. And you breathe one in and it sticks in your sinuses, or you swallow one down your esophagus, and it can replicate and have babies and build communities and families, and they aggregate together and form a colony, and then they secrete a glycoprotein matrix around themselves called biofilm that protects them from your immune system and from antifungal agents. And from there, they just release mycotoxins in your system that, many of them are nerve toxins. They're toxic to the central nervous system. Yeah, so it can be from a previous exposure or a current exposure.
I haven't come across it mold, but maybe mold and fungus are similar. I've had patients who've had like literally lumps of fungus removed out of their lung and that kind of stuff.
Oh, that's bad.
Yeah.
Yeah, so mold is a fungus.
Okay,
Yeah.
so same.
Yeah, so a fungal ball and
Yeah.
like the lungs or something would be, yeah, mold.
Is that extreme to find the fungus growing inside you, or do we need to focus on that or not?
Well, a fungal ball in the lungs is very extreme.
Okay.
But colonization in the sinus is pretty common. And you can colonize in the GI tract or other places in the upper respiratory tract. I always laugh that the purpose of mold on the planet is to turn over and decompose organic dead matter to turn it into soil for fresh growth.
Yeah.
But you don't want mold trying to decompose your own living organism from the inside out.
Yeah.
So it's pretty gross.
Okay, so a person has some symptoms. Maybe they do their online visual test and they see something. So now they're interested. They take a urinary test, it comes back positive. So we're correlating now their results of the test with their symptomatic picture. And it's like, yes, you probably have had some chronic exposure to mold. Now what? What do you do as a physician?
Well, two things. One is I start them on a mold detox protocol. So we do things that help you metabolize, detoxify, pull these mycotoxins out so that you're not so sick. So I would get them going on that. And then I would have them do a test on their home. And so there's a kind of an easy DNA dust test that's do it yourself called a qPCR and ERMI. And it's kind of just quick and dirty. Like, does it look terrible? Do you need to get somebody out, or does it look pretty clean? If you're suspicious that you've got mold in your current house, like you've had some water leaks, you smell something musty in the bathroom or something like that, then you're going to want to get an indoor environmental professional out to do a full evaluation of the house.
Yes. And I interviewed Jason Earl in episode 34. And he talked about how to test your house and then how to remediate your house as well. So if anyone wants to listen to that, that's episode 34. We go into detail on what to do in your home.
Perfect.
Okay, so these things that are growing, let's say in your sinuses, do they need more, like how do you identify them in your sinus, or is that just a place they commonly grow?
It's a common place of where they're living in you if it's a previous exposure. We don't have great tests. There are some nasal swabs. We often don't catch it on a nasal swab. I think it's more in here than where we can get to with the swab. And so when I get a positive urinary mycotoxin, and I'm not doing a mycotoxin on somebody that I'm not already suspicious of, they have all the symptoms. And usually by the time people come to me, they've seen 20 to 40 doctors and they've seen all the specialists. So, I'm not doing the initial workup of all the other million little things it could be. Usually they've had all that done by the time they come to me. Mm-hmm. And so when I get a positive urinary mycotoxin test, I just assume colonization. And then what happens? So the way I treat mold is it's two phases. Phase one is teaching your body how to detox and pull these things out with binders and glutathione and other things. And then phase two is kill or be killed, where we kill any colonized mold living in the system. Now, if you don't have anything living in the system and you just breathed it in your current home and then peed it out for the test, you will get 100% better on phase one. And you won't need to do antifungals and stuff. And that's kind of how we can tell. You get out of the exposure, you do phase one, and they're 100%. They didn't colonize.
So these colonizations then, so I'm just going back, they don't like, you can't see them on X-ray or anything like that.
Not really. So there's some MRI imaging that you can occasionally see, sort of more like socked in the sinuses, and then we have an ENT that specializes in biotoxin illness that does surgeries, and he pulls out these fungal balls from people's sphenoid sinuses and other sinuses that we couldn't see on any imaging. Which is,
Interesting.
yeah, insane, right?
Have you seen one of those fungal balls? What do they look like?
I mean, black and nasty.
Like you'd expect mole to look like.
Yeah, kind of like gross. You just can't. I mean, when I saw it the first time I saw it after my patient had it done, I was like, wow, there is nothing I would have done that would have gotten you all the way better. Like I can't get an antifungal to up in your sphenoid sinus. There's no blood flow.
There's no blood flow and it's protecting itself with the biofilm.
Right.
Okay, so you need an ENT specializing in removal of like mold.
Most people are not colonized like
No,
that.
I
Most
understand.
people we can handle. The 99% of patients would get better with a just regular mold
I'm
protocol.
with you. Now, did that person, or can you think of another example of a patient, have dramatic recovery from their symptoms to either going through the protocol or having it removed to a recovery? Can you give me an example?
Yeah, he was tricky because he wasn't responding like I would think. He also had Lyme, so it was, a messier picture. But we tried, a variety of different antifungals and different treatment regimens, and he got a little better, but he was in a ton of pain,
Was
like
that
in his
the main
face.
symptom was pain? Or
Yeah, a lot of
yeah,
pain. He was young. He was like 21.
wow.
I mean, he had all kinds of systemic symptoms as well, and he just wasn't, he wasn't really, most people respond really well. I find mold to be really treatable and a great diagnosis. People do really well, and he didn't. And so he ended up going to that guy and getting it removed, and then he responded great to the whole protocol. We had to clean up, the mess from once you pull something like that out, it spreads more mycotoxins in the brain and in the system. So we had more work to do, but he did great.
So
Yeah.
you mentioned the brain there as well. Does mold affect things like mood or even depression, that kind of thing?
Yeah, some of the most common symptoms are anxiety and insomnia, and often depression, sometimes suicidality. And in kids, it's often more neuropsychiatric symptoms than, tummy aches and headaches, but then they all of a sudden are anxious. They all of a sudden can't sleep. They're all of a sudden depressed and crying out of nowhere, and they might get OCD, they might get tics. Yeah, it
Mhm.
presents more like that in kids. So a lot of the mycotoxins that are pathogenic or disease causing are nerve toxins. So they attack the central nervous system and the peripheral nerves as well.
There seems to be an epidemic of kids now getting more depressed and more anxious. And, we can point fingers at lockdown, we can point fingers at COVID and so on. Do you think mold plays a role in that as well?
Yeah, I do. And I think that so the number has always been only like a quarter of the population is sensitive to mold.
Mhm.
But I really feel that number is increasing, and I think there's a variety of reasons why. And yeah, I have a lot of kids on college campuses that are patients that are mold sick that were brilliant and going to Stanford, for example, and then suddenly they can't think and they're anxious and they're foggy and they're exhausted and they can't get up out of their beds and I think we all probably went to college in moldy dorms, So I mean, I think things are changing and people are a bit more sensitive, and I think kids are more sensitive. I always sort of blame the blood-brain barrier. I sort of think that, glyphosate, I don't know if you guys have glyphosate as it's not legal in England, is that?
Well, in the EU, I think it was banned. Yeah.
Yeah. Yeah, yeah. So it increases permeability of the blood-brain barrier, and then things can get in, and then you get autoimmune, things like, do you know pans and pandas,
Anderson, yeah.
immune encephalitis? Yeah.
Mhm.
I sort of think, partially the reason kids, and also it's total body burden. So your system doesn't crash until your bucket is full and completely overflows. So imagine you're born and you get some exposure to plastics and pesticides, and then maybe you get COVID and you get a ton of inflammation from that. And then, if you live here, you can't avoid glyphosate. And then maybe biotoxin from Lyme, or who knows, and then you live in a moldy place, and that those mycotoxins might fill up your bucket and crash the system. And so I think that our kids are exposed to, a lot more chemicals and worse toxin, like they're more toxic than they used to be when we were young. And
Mhm.
so I think their buckets fill up easier and the system crashes.
So let's keep talking about kids here, because I think a lot of parents are obviously more worried about their children than they are about themselves sometimes.
Mhm.
So let's say someone has a kid and perfectly normal to start with, but that bucket started filling up, and they're not sure if whether it's with mold or whatever. If they took them out of their house, but they had had a mold exposure, and let's say they're away for a weekend or even a week's vacation, would the symptoms change, or do you think it would continue?
Yeah, no, that's a big clue.
Mhm.
So not everybody, it probably depends on your total body burden, but a lot of people will go, oh my gosh, I went away for a week or two and I felt completely fine.
Mm.
And then they think it's confusing because they were on vacation. So they're not stressed and they're not having to take care of their kids, and, they don't know, but then they come back and all the symptoms come back when they come back into their house.
Mhm.
I think it takes more than a weekend, but kids are more resilient. So I used to notice when we would go camping, my son would be able to be active and play a lot more. But I feel like adults, it's a week or two out before they feel any different.
Why do you think we as humans have problems with mold? And you mentioned some outdoor molds don't cause a problem, but some other molds do. And I feel like, as our evolutionary past, we would have been, in the woods, we would have been sleeping on the ground and exposed to mold quite a lot. What is it about these particular molds in the houses that we have nowadays that are problematic?
Well, they're mycotoxin producing,
Okay.
and mycotoxins are pathogenic to humans, and the ones outside don't generally produce mycotoxins.
What is it about our houses that causes like that's friendly to the mycotoxin producing mold?
I think it's the particular types of mold that grow. And then also they're in an indoor space. So, they're getting the concentration is higher than if you're outside and open air. So one of the things I always tell people is open your windows, ventilate as much as you can. It's the concentration and the density of the mycotoxins in the house. We build our houses that are more energy efficient now, where they're really sealed tight. And so those, the old houses are built with draft on purpose because of mold.
Mm.
So, there's a little airflow and it doesn't get so concentrated. And then we also know that if you expose mold to electromagnetic frequencies, it releases 10 times more mycotoxins. So maybe we could have, handled some mold in the basement, and then we put our Wi-Fi down there, and then it's 10 times more mycotoxins in the air. And then our buckets are more full from the world we live in.
So someone comes to you, they've got their positive diagnosis, they've gone through a course with you, and people might be listening to this and saying, well, that's all well and good for the residents of Boulder, Colorado, but what about me? I live in the UK, or what about me? I live in Canada. What can they do?
Yeah, well, you can look for, a doc who knows how to treat mold. And I'm a founding member of an organization called ICI, which is the International Society of Environmentally Acquired Illness. And there are, mold docs all over the world that we're all in this same organization together. So you can see if there's someone near you. And then, so I'm an MD in Colorado, and I can really legally only treat people in Colorado. So I get calls from people all over the world. And so I created a course that's kind of a do-it-yourself that walks you through. It's a very sort of step-by-step, spoon-fed, kind of methodical, gentle phase one and phase two mold eradication protocol that's designed to help you get all the way better and healthy again, but also not to make yourself more sick. So a lot of people will get parts of the information and try to treat themselves, and they'll go too fast, and basically they're trying to detox more than their body's capable of, and they get sicker, and then they think they can't get better. So in phase one mold detox, you're binding these different strains of mycotoxins and pulling them out in the stool, and you're giving the body the things it needs to metabolize it to get it out in the urine, the stool, and the sweat. And then you add in antifungals and biofilm. But you can imagine, so if somebody came into me really mold sick and I started them on an antifungal that kills mold living in the system, when you kill the mold, it releases more mycotoxins.
Mm.
And so I would just flood their system with more of the very same thing that was already making them sick. So there's a particular order to it. And you should really only feel better in a good mold protocol. You should never feel worse. Because when we try to detox more than we're capable of, we mobilize these toxins to different places. They might end up in a worse place than when they started. So it's not one of those diagnoses that you get better before you get worse. You really should not suffer through it.
What do you do in phase one? What sort of things are you using? Are you using pharmaceutical stuff? Are you using natural things?
Mostly natural stuff. So there's different binders for different strains of mold. And so when you get the urinary mycotoxin test, you know which binders you need. So binders are things like activated charcoal, bentonite clay. They bind these mycotoxins in the GI tract and pull them out in the stool. You don't absorb them into the body. And then things like liposomal glutathione will help you metabolize it so you can get it out. I do a lot of organ detox support, so kidney, liver, lymph, opening up all your detoxification channels and pathways so you can begin draining that bucket on your own. There's a lot of things that you can do to help the process go quicker, like infrared saunas, ionic foot baths, detox baths, stuff like that. And in phase two is kill or be killed. So then that's antifungals and biofilm.
What's a good example of an antifungal?
Itraconazole, voriconazole. But this is when you start the antifungals is when the needle really moves. That's when you get the big clinical turnaround. After I start the antifungals on the next visit, they're like, "Oh, I feel so much better."
Yeah. Yeah.
So I know people have, they're coming to a holistic doc thinking it's going to be all natural, but there really aren't great natural ways of killing the mold in the system.
If someone's working with you online or doing this online program, how would they get those antifungal medications?
Yeah, so it's an online course. It's about 35 modules. They're really short and kind of easy to get through. And there's a lot of different guides too. One of them I have a find your supporting physician guide. So there's only a couple prescriptions that you need. One, ideally, you would get a compounded prescription nasal spray that is trying to get into the sinuses. There's alternatives if you can't get that. And then there's if you need cholestyramine or Welchol, it's a particular kind of binder, then you need a prescription for that. And then for the antifungals, you'll need a prescription for that. And in the finding your supportive physician guide, I give a lot of different directories and resources for, you want somebody kind of holistically oriented, not likely a primary care doc unless they are open-minded. But any Lyme doc will believe in mold and they don't all know how to treat it. Most functional medicine docs know about mold, but they don't all do it. So they'll support you. There's the American Board of Integrative Holistic Medicine, Institute of Functional Medicine's directory. Yeah.
So with this course, with those modules, does a person get to interact with you at all, or do they get a support group or anything like that?
Yep, there's a couple different options. So there's a do-it-yourself, just go through the modules on your own. And then you would be part of the community support forum. And then there's another option where you have twice a month Q&As with me as you're going through the course.
Mhm.
And both you're in the community support forum.
Earlier on, you mentioned about how the mold toxins can damage the nervous system or cause neurological problems. What sort of illnesses come from that damage?
Yeah, well, I mean, like I was saying in the beginning, there's a lot of unusual neurological presentation. So I have people that come in with fasciculations, which are like involuntary muscle movements all over their body, like all the time, like weird neurologic things like that. People have burning sensations, ice pick sensations, crawling sensations. They'll get ataxic, so they'll have balance issues. We see a lot of POTS, if you're familiar with that. So dizziness, lightheadedness, a lot of hypermobility we see as well.
That but that's so a connective tissue problem that's like a predisposition to that, or like I'm not quite sure how that works.
Yeah, I think so. The EDS spectrum,
Yeah.
right? So, I think that biotoxin illness makes it worse. So it's not necessarily the cause. Most people that have it, probably had a gene, a genetic predisposition, but it makes the hypermobility worse. So we see them getting more injured. And then when you treat the mold, it'll get a little better. They'll be a little less hypermobile.
What about mast cell activation?
Yeah, a lot of that.
Yeah.
Mold is a very common trigger of mast cell activation syndrome. Yeast is as well.
Okay. I recently had a patient who was working with me for back pain, and they were very apprehensive because everything they tried in the past would trigger this. They described it, it's like, I click something in my back. So there's a connective tissue disorder because you shouldn't have a hypermobility in between your shoulder blades. And it would put the shooting pain down into their hands. And then they would be flat on their back for a week with just fatigue. That was their symptoms to me. And I was like, okay, all right, well, we'll take it very carefully and so on. And then throughout we did 12 sessions. Throughout the sessions, they got tested and they ended up with being diagnosed with a thing called mast cell activation syndrome. And then they traced it back to a mold infection in their previous home.
Yeah, that is interesting.
So, what could a person be eating that could be possibly better for their mold exposure, or maybe even worse for their mold exposure?
Well, so if you do an anti-inflammatory diet, that'll help reduce your inflammatory load. The one mycotoxin that can get elevated just from food is aflatoxin. So if I have a patient whose urinary mycotoxin is positive, but it's just aflatoxin and it's not that high, I'll write that off to food sometimes.
What
Um,
that toxin being? What food is that in?
oh, nuts and berries, coffee beans.
Oh yeah, okay. So
Um,
the common, well, for some people it might be common, but there's a lot of talk in the social media at the moment about peanut butter and coffee being problematic because of the amount of mold. Is that
yeah.
something that you're concerned about? You're aware of?
I'm aware of it, and it like to me, the mycotoxins that you get from the food that you eat are a drop in the bucket relative to breathing them in a water damaged building all day.
Yeah. Okay.
And my patients, by the time they come to me, they might have SIBO and they might have MCAS and they're layering FODMAP diet on top of an antihistamine diet on top of a mold diet and they're eating five foods and it's just not healthy. So I tell them not to worry about the low mold diet.
We talked a little bit about the glycinate having a potential problem on the blood-brain barrier and that maybe increasing people's susceptibility to mold. Do you think that mold in general in our homes has also got worse?
I mean, I think in the US, the way that we build, I think that we build our homes out of mold food. So it's all cellulose, it's all drywall and wood. This is what mold and mycotoxins live in. If you have glass and steel and cement, you're much less likely to have a mold issue.
And how does a person go about remediating that? I mean, I know I've talked to the guy on a different podcast, but what's been your experience of you clear someone up or you tell them how to get rid of the mold in their bodies, but they still got to get rid of the mold in their environment? How do they do that?
Yeah, so they either move out or they remediate. And so a good remediation is removing any wet, damp, moldy materials, going a full 24 inches past what you know is damp or wet. And then that has to be done under containment. So as soon as you disturb mold, you pull drywall out of a wall, it releases all the spores. It goes and then it gets in your HVAC ducts and, in the fabric of everything around you. So it has to be under containment with negative air. And then the nanoparticles and the fragments and the mycotoxins that mold releases in the house, they can land in your drywall and your wood. And so everything has to be, you HEPA vacuum every single surface, and then you wipe down every surface with a microfiber cloth and an antifungal agent, and then sometimes you fog at the end. But yeah, it's kind of a big process. If you don't have HVAC ducts, it can be less.
Dr. Fox, it's been a real pleasure having you on the show. Is there anything you'd like to say to people who think they've got mold exposure?
Yeah, I would love to just say to, have hope and you're not alone. And mold is a very treatable diagnosis. People do great. It's not that hard to treat. Sometimes it can be tricky to get out of the exposure, but once you do that part and you start treatment, people do really, really well.
No, that's excellent. That's such a positive message. So where can people find you and maybe learn a bit more about your course?
Yeah, sure. So drfoxmedicaldetective.com is the website that has the course on it. And there's also a webinar that I did on mold that you can watch if you're interested. And then my medical practice is boulderholistic.com, and we have a lot of blogs and information on there.
Thank you very much. And I'll put all that information in the description below.
Great. Thank you so much for having me.
Thanks for being on the show. Thank you for joining me in my conversation with Dr. Terry Fox. Now, if you've enjoyed listening to and learning from this podcast, please leave a comment and leave a suggestion for a future podcast guest that you would like us to feature. If you're on Apple, leave us a 5-star review if you're so inclined. And remember, if you want my direct help, you can send me an email, ed@edpadgett.com, or visit my website, edpadgett.com, where you can learn a little bit more about how I can help you make your lifestyle your medicine.